Today, we shall discuss the risk factors for breast cancer. This is one of the most common and important questions asked by a breast cancer patient, that why I got breast cancer. There is no single etiological or causative factor for breast cancer. Risk factors can be classified as modifiable and non-modifiable risk factors. First, we shall look into some of the non-modifiable risk factors for breast cancer. Being a woman is the most important risk factor for developing breast cancer, and female to male ratio is 150:1. And the next most important risk factor is the age. The risk for breast cancer increases with age, and most breast cancers are diagnosed after the age of 50 years. And early menarche before the age of 12 and late menopause after the age of 55 years exposes an individual to prolonged exposure of estrogen and increases the risk of developing breast cancer. And genetic mutations, that is inherited changes or mutations to certain genes such as BRCA1 and BRCA2, are identified as an important and non-modifiable risk factor for developing breast cancer. So as we can see in this slide, all the risk factors which we have discussed are non-modifiable, where we can't do much about them. So we shall discuss the modifiable risk factors for breast cancer. Being overweight or obese after menopause puts an individual at increased risk of developing breast cancer, because the fat converts it into estrogen, and there is more exposure of estrogen, and there is an increased risk of developing breast cancer. And if a person is nulliparous, or if the age at first pregnancy is more than 30 years, or if the person has not breastfed, then the chance of developing breast cancer is more. So as we can see, all of them are modifiable risk factors. So one should be physically active and try to have the first pregnancy before the age of 30 years and breastfeed their children. Some women will get breast cancer even without any risk factor, and having risk factor doesn't mean that one will get breast cancer. So this is in brief about the risk factors for breast cancer. And coming to the scenario in India, there is an increasing incidence of breast cancer in India, and we are witnessing more and more patients being diagnosed in the younger age group. Can we change this trend? I don't think so. It's difficult. But what we can definitely change is our ignorance and our lack of awareness. So come, we shall together create awareness about breast cancer, and in my next presentation, I'll be discussing about symptoms and signs